Hello and welcome to my presentation on cystic fibrosis, also known as CF. To begin my presentation, I have created a Kahoot with 10 questions about cystic fibrosis, so please feel free to pause the video and do the Kahoot yourself. What is cystic fibrosis? According to Cystic Fibrosis Foundation, Cystic fibrosis is a genetic disease that causes a buildup of thick, sticky mucus in the lungs. CF causes ongoing lung infections and makes it hard to breathe over time. CF also affects other parts of the body, including the pancreas, and makes it difficult to digest food and maintain a healthy weight. Cystic fibrosis affects multiple systems, including the respiratory, digestive, and reproductive systems. It is a chronic and life-limiting genetic disorder, meaning it is not contagious. It is caused by mutations in the cystic fibrosis transmembrane conductance regulator, short for CFTR gene, which leads to the production of thick and sticky mucus. The mucus is a big factor as it affects many of the symptoms that follow CF. Some myths and facts about CF. CF is contagious. In fact, it is actually a genetic condition, meaning it is inherited through genes and it is caused by mutation of the CFTR gene. CF is solely a lung disease. While CF primarily affects the lungs and digestive system, it actually impacts multiple systems and organs within the body. CF only affects children. Although it is detected during childhood, unfortunately, CF is actually a lifelong and chronic condition that requires ongoing management and treatment. CF is curable. Unfortunately, there is no cure for CF, although there has been significant progress in understanding the basis of CF genetically and molecularly. CF makes a normal life impossible. Absolutely not. Thanks to advancements in research, technology, and medical treatments, CF patients can now benefit from a range of therapies and interventions that help manage symptoms, prevent complications, and improve quality of life, meaning children can grow up living relatively normal lives. I found this fantastic interactive website where children can learn about CF. I think it is a really fantastic tool for education when children may learn in an environment with a child that has CF or if they have it themselves, and it allows them to understand it a bit more clearly. Nature of cystic fibrosis. According to Sick Kids, CF is a genetic condition that mainly affects the lungs and digestive system. The body creates normal mucus, which is thin and slippery. However, this mucus helps remove dirt and germs. But the mucus in CF patients is thick and sticky and it clogs the tubes within the body. This can make breathing extremely difficult. Bacteria can collect in these tubes because the mucus doesn't clear as quickly as it's supposed to, leading to infection, inflammation, and damage to the body. Cystic fibrosis is caused by a mutation in the CFTR gene. When both parents carry these recessive genes, their child is born with a mutation in the CFTR gene, which can lead to various types of defects in the CFTR protein. According to Mass General Brigham, these defects may affect the production, function, stability, or processing of the CFTR gene protein, resulting in impaired chloride ion transport and dysfunction of the cells lining the respiratory, digestive, and other systems. This in turn impairs the regulation of salt and water movement in the body. Cystic fibrosis is a condition that gets worse over time as lung function declines and complications arise. This is known as a progressive condition. The rate of disease progression may differ from person to person, and the symptoms can range from mild to severe. The course of the disease can be influenced by various factors such as age, genotype, environmental exposures, and individual health status. Despite the advances in treatment and care, CF remains a chronic and life-limiting condition that requires constant management and support to enhance outcomes and improve the quality of life of patients. Symptoms. The symptoms of CF can be quite extensive and vary in degree for each patient. These symptoms include persistent cough, respiratory infections, shortness of breath, wheezing, poor growth and weight gain, frequent sinus infections, salty taste of skin, digestive problems, nasal polyps, clubbing of finger or toes, fatigue, rectal prolapse, diabetes, osteoporosis, infertility, liver disease, pancreatitis, malnutrition, chronic sinusitis, and intestinal obstruction. This is a very long list. The extent of cystic fibrosis worldwide. CF varies among different populations and regions globally. While more common in Caucasians, CF can occur in people of all ethnic backgrounds. Rates are influenced by factors such as access to healthcare and treatment. Advances in medical care have improved outcomes for individuals with CF worldwide. However, access to healthcare and treatment may vary across countries. CF affects individuals of all ethnicities. Certain populations may have higher prevalence rates or more frequencies for carriers. However, CF is typically inherited in a recessive manner. Genetic counselling and carrier screening programs are available in many countries to assist individuals when planning family decisions. The extent of cystic fibrosis in Australia. Approximately 3,600 Australians are currently living with CF. It affects 1 in every 2,500 babies born in Australia. The carrier frequency of the CFTR gene mutation is estimated to be around 1 in 25 Australians of European descent. The median predicting survival rate for Australians with CF in Australia is over 37 years. Advances in medical care and treatments have significantly improved life expectancy and quality of life for individuals with CF. However, it still poses challenges, including respiratory systems, digestive issues, and other complications. CF affects individuals of all ethnicities in Australia. There are higher prevalence rates observed in Caucasians of European descent. It is typically inherited in a recessive manner as well. And same thing, genetic counselling and carrier screening programs are available to help individuals understand their risk when having a child with CF. Treatment. According to Mass General Brigham, there are a multitude of treatment options. Although these treatments do not cure the condition, they assist in managing symptoms and allow children and people to live more comfortably and fulfilling lives as they manage these chronic conditions. Treatments include medications such as antibiotics to treat and prevent lung infections, mucolytics to thin mucus, bronchial dilators to open airways, and anti-inflammatory drugs to reduce lung inflammation. Chest physiotherapy, which includes percussion and postural drainage techniques to loosen and remove mucus from the lungs. Airway clearance devices such as oscillating positive expiratory pressure devices and high-frequency chest wall oscillation vests to aid in clearing mucus. Nutritional support, including enzyme replacement therapy to aid digestion, high-calorie diets to maintain weight, and vitamin supplements to address absorption. Regular physical activity to improve lung function and overall fitness. For severe cases where lung damage is extensive and irreversible, there are lung transplants. Emerging treatments aimed at correcting the underlying genetic defect responsible CF include gene therapy and clinical trials, where participation in research and trials testing new therapies and treatments. Factors influencing children and families. Children with cystic fibrosis face a range of health challenges, including persistent respiratory systems like coughing, wheezing, and frequent lung infections. They may also experience digestive issues, nutritional deficiencies, and pancreatic insufficiency, which can lead to poor weight gain and growth. Managing CF requires complex treatment regimen, which often includes daily medications, chest physiotherapy, airway clearance techniques, and nutritional supplements. These treatments can be very time-consuming and burdensome for both children and their family. Children with CF may need frequent hospitalizations and medical visits for disease management, extubations, and monitoring the lung function and nutritional status. These hospitalizations can disrupt everyday routines and impact the child's schooling and social activities. Living with a chronic illness like CF can take a big toll on a child's emotional well-being and psychological development. Children with CF may experience anxiety, depression, and stress related to their health treatment and future prognosis. Likewise, parents and caregivers may experience increased stress, worry, and emotional strain in caring for a child with CF. Managing CF can result in significant financial expenses for families, including costs associated with medications, medical equipment, hospitalizations, and specialized care. These financial burdens can add stress and strain to the family's resources, impacting their overall quality of life. Children with CF may face social isolation due to infection control measures, such as avoiding contact with other individuals with CF to reduce the risk of cross-infection. This isolation can affect their social relationships, school attendance, and participation in extracurricular activities like sport. Families of children with CF may have genetic concerns, especially if they have other children or are planning future pregnancies. Genetic counselling can help families understand the inheritance pattern of CF, assessing their risk of having another affected child, and make informed planning family decisions. Building strong support networks is essential for children and families coping with CF. This includes healthcare professionals, support groups, and community resources that provide information, education, emotional support, and practical assistance in managing the challenges associated with CF. So I found this fantastic video directed from children to teachers about living with cystic fibrosis. I think it carries a very positive message about their point of view. So let's watch.
When you see me, what do you see? A kid? A student?
A teenager?
A tomboy? A musician? An athlete? An artist? I look like everyone else.
But I have cystic fibrosis. Or CF.
I have CF.
I have CF. I have CF.
And you wouldn't know unless you know.
Because I don't look sick. I should be treated like any other kid.
But here's the thing.
I may need to go to the restroom more often.
Eat in class more often than an average student. And cough more often. A lot.
But I am not contagious.
I promise.
I might be absent from school
For doctor's appointments, lung infections,
or even hospital stays. Right now, there is no cure for CF, and it will not go away.
CF doesn't affect my intelligence. And I really want to learn.
But I might need your help with keeping up with my schoolwork. With your help and understanding,
I can have a normal school experience just like everyone else.
and that would be cool. Thank you.
Thank you.
Thank you. Thank you.
Thank you.
Thank you. Thank you.
Health promotion strategies like the newborn screening test. So, newborn screening test programs have been developed to identify infants with cystic fibrosis shortly after birth. According to New South Wales Health, the process of screening involves collecting a small blood sample from newborns, usually from their heels, and testing it for genetic markers associated with CF. Early detection of CF through newborn screening helps in the prompt initiation of treatment and interventions, which can lead to improved outcomes and quality of life for affected infants. Newborn screening programs for CF include CF screening as part of their routine screening process. After birth, a blood sample is collected and tested for various conditions, including CF. If the initial screening test confirms a potential CF diagnosis, additional confirmatory tests are performed. If CF is confirmed, the family is referred to a specialised CF clinic for further evaluation and management. 5 Feet Apart. So, 5 Feet Apart is a well-known novel and film initially written by Rachel Lippincott. It is a romantic journey of two CF patients and their unlikely relationship whilst living through CF. According to Parsons, the story, although very romanticised, shed light on the daily struggles and realities of living with CF and what it is like. Although it is dramatised, many believe it was a positive way to raise awareness about CF. I know personally when reading the novel, it was the first time I had ever been exposed to the illness or heard of it. Parsons says, some held the belief that any publicity for CF is beneficial. 5 Feet Apart gained attention and public understanding. Sure, the details weren't quite right, but that's just Hollywood. In the article, she discusses the differences between growing up as a child with CF in the 70s to now, discussing how living with CF can have its major moments, such as in the story, but also about the community of CF patients and things such as daily activities like regimen routines, medication, etc. The detail about the 5 feet apart actually relates to the 6 feet apart rule, which says the CF patients should stay 6 feet apart to ensure there is no cross-contamination of different bacteria, which can be harmful, but they allowed for 5 feet within the story for their relationship, which I think is kind of cute. For part of my presentation on CF, I decided to conduct a survey to find out what others knew about CF and to assist in my assessment. My findings were that majority of people know about CF. Only 7% have never heard of the illness. Comments included, know it is a genetical that affects the lungs and life-threatening condition that impacts the lungs and digestive system. 85% of people knew of symptoms such as a persistent cough, but only 14% knew about symptoms such as salty tasting skin. 100% agreed that for children it can negatively impact their daily activities. Comments included, they probably struggle as it can be difficult to grasp the complexity of the disease, and with the correct medication and medical interventions, hopefully children can live full and productive lives, e.g. diet, physiotherapy, etc. Only 14% believe that children have adequate access to healthcare and specialised treatment. Comments included, as a lifelong chronic condition, I imagine that the cost of preventative treatments might be out of their reach of some parents and could impact on their quality of life. And hopefully the NDIS scheme assists. And location, especially those living in remote areas, financial barriers. 100% agreed that there should be more efforts to promote inclusivity and the understanding of children living with CF. Only 35% have ever seen public awareness campaigns or initiatives about CF. 100% are unaware of recent advancements in CF research and treatment. Comments included, all research on children's diseases should be high on the government list. 71% agreed they would be willing to support raising awareness and improving support. 14% know of someone living with CF. The majority, 71%, were unsure if there is enough support and resources available for children with CF and their families. And comments included, in my 40 years of teaching, I have only ever had one student who had cystic fibrosis. It was managed with enzyme tablets before eating and physiotherapy. Overall, I found the results conclusive that the majority of people have heard of cystic fibrosis. However, they do not know much about it. The positive outcome, though, is that majority are willing to support it and children who have it, meaning there is always hope for children and their families struggling with these conditions, and they all believe they should be a top priority. In summary, cystic fibrosis is a genetic disorder affecting the lungs and digestive system. It is caused by mutations in the CFTR gene. CF results in thick, sticky mucus obstructing airways. The symptoms include respiratory issues and digestive problems. The treatments involves medications, physiotherapy, dietary interventions. Early diagnosis through newborn screening is important. Advances in medical care have improved outcomes, and CF still impacts life expectancy and quality of life. Thank you.